Hi everyone, thank you for joining me in today's chronic pain webinar. My name is Cyrus. I'm the co-owner and formulator of Pure Lab Vitamins. I've been a compounding pharmacist with specialty in chronic pain for half my life. And I have seen my fair share of very drastic chronic pain cases over the years. Individuals suffering from either injury or trauma or from late effects of surgery, but also chronic migraines, arthritic conditions, actually any kind of chronic inflammatory condition, diabetic neuropathies, and any other kind of neuropathy like sciatica, any possible kind of back pain, PMS, endometriosis. The list is very, very long. So when I thought about what to present in this webinar, it was pretty clear that most of you will have very specific questions anyway, so I decided to cut the presentation part to really just my general observations and tidbits from dealing with chronic pain as a compounding pharmacist and provide a few insights into what I took away over the years, and then actually open up the Q&A part early so that we can cover all your questions. So, there's actually a very interesting way to explain acute pain versus chronic pain. When you stub your toe, you immediately feel a sharp pain, right? And this pain information from the toe to the brain travels on the 911 line to the brain, super fast. But once your brain realizes, yes, I know there is pain in the toe, but it's not life-threatening, the brain switches from the 911 system to the less important network, the so-called C fibers. And this switch you can actually feel because your pain perception changes from one moment to another, from a sharp acute pain to a more dull throbbing pain. And this switch is meant to keep the 911 lines open. But what is interesting, these C fibers use one specific type of receptor, the so-called NMDA receptor. And with this type of receptor, we can run into specific kinds of problems. So here we have an image of such an NMDA receptor. And this is going to be a bit technical, but please just follow my lead, and I'm sure you will understand all of this. So the dark blue area above is the so-called synaptic cleft. This is the space between two neighboring C fiber cells. In order to transmit a nerve impulse from one cell to another, glutamate, a neurotransmitter, gets excreted into the cleft. And then it needs to dock onto the receptor on the next cell, the next C fiber cell, and when sufficient glutamate has docked on, then calcium has to shoot through this central channel into the next cell, creating a new nerve impulse inside the next cell. And this happens now in C fiber after C fiber cell until this nerve impulse reaches the brain. To tell the brain, hello, there is pain in the stubbed toe on the right side. And the more impulses reach the brain, the more pain is felt. Now let's have a closer look at this calcium channel. You'll notice there's a binding site right in the middle, and oh look, it's a magnesium binding site. Isn't that interesting? And it's the job of magnesium to occupy this channel so that it's not easy for a new impulse to be transmitted. Magnesium inhibits this receptor. But if a lot of glutamate comes knocking, then magnesium gets pushed out of its binding site, and then there's a lot of pain impulses traveling along this C fiber cell and the whole C fiber network. And that's the case in more severe pain conditions like injury, trauma, surgery, etc. And then magnesium has little chance to settle back and occupy this channel. This means the receptor stays more sensitive, and the unbound magnesium is floating around elsewhere unused and will at some point get excreted. And this is exactly why chronic pain causes magnesium deficiency and pain amplification. So long-term, chronic pain causes more chronic pain. Now let's have another close look at the NMDA slide. Right at the top here, we have a binding site for glycine. Glycine as in magnesium glycinate. Glycine also works as an inhibitory neurotransmitter. Just like magnesium, it also tries to keep the NMDA receptor calm. And this is the reason why magnesium glycinate works so well for chronic pain. Magnesium and glycine work together in preventing overshooting pain levels. But someone who has been dealing with chronic pain for a longer time will be, by nature of this beast, more severely magnesium deficient. And that means, in order to achieve improvements, you will have to use larger daily amounts of magnesium glycinate initially, in the beginning, to help replenish all tissues of the body, including the C-fiber network. So looking back on 20 years of working with magnesium glycinate in chronic pain and other conditions, I can clearly say that therapeutic dosing of magnesium glycinate, ideally when combined with a bioactive B complex, has made a significant difference in practically 100% of my clients and customers. Obviously, magnesium and B vitamins will not resolve such complex conditions by themselves, but they will have a significant impact on quality of life and maybe reduce the need for prescription pain medication. And together with targeted exercise, stretching, and maybe some lifestyle changes, they will help you get back to a life of more quality. Now, I'd like to touch on just a few pain conditions in a bit more detail. Number one, diabetic neuropathies. These are characterized by changes in sensations such as numbness, shooting pains or burning pains, most commonly in the feet or hands, in the periphery. These symptoms are associated with nerve damage caused by poorly controlled diabetes. In this situation, blood sugar is commonly elevated if poorly controlled, and the sugar coating of your cells has damaging effects on the nerves and blood vessels. With higher sugar concentrations, the blood gets more and more viscous, thick. You can imagine that thick, sugary blood has a harder time circulating through the fine capillaries. And many of these fine nerve endings sit in the deep peripheral tissues. And they usually are supplied 100% by the capillary system. Diabetics typically have low blood levels of magnesium, folate, zinc, and B12, and many other nutrients. And there's some evidence that B vitamin supplementation may reduce neuropathic pain. Another lesser known fact: insulin, the hormone that regulates blood sugar levels by telling the cells to take sugar in from the blood into the cells, is only active if magnesium is bound to it. Furthermore, insulin receptors in the cell walls also require magnesium to be functional, to be more sensitive towards insulin. So, but we just learned that diabetics typically have low levels, blood levels of magnesium. So you now understand that this causes a vicious cycle. Diabetes causes loss of magnesium. Low magnesium causes less active insulin and less sensitive insulin receptors. And all this causes higher sugar levels, which causes more loss of magnesium. Every diabetic needs to be on magnesium. Not just when diabetic neuropathies occur, but long before, to prevent these problems from occurring. Obviously, you need to also learn to work with sugars better. For the magnesium, therapeutic dosing is the key here. As directed on our label, we recommend taking 3 capsules per day. That is what Health Canada allows me to put on my label, because this presents the recommended daily amount, or RDA. The average daily requirement for the average Canadian. But a deficient diabetic is not an average person, and 3 caps per day is not a therapeutic dose. Some of you might have heard of the so-called Magnesium bowel tolerance protocol, which we developed with the pain clinic at CHIO here in Ottawa many years ago. And this protocol should be considered when consulting with a naturopathic doctor or a nutritionist. Most NDs in Ottawa have this protocol on hand anyway, and if not, they can always contact us. These practitioners also follow your progress and take your whole health into consideration. They will also review your dietary intake and suggest diet modifications, which will further help your case. Every diabetic needs a bioactive B complex. Also, not just when these neuropathies occur, but long before, to prevent them from occurring. And at this point, let me quickly explain the need for a slow-release B complex formulation. B vitamins are water-soluble. They flush through us very quickly. We can actually see that. Within about 10 minutes of taking a regular B complex, your urine turns bright yellow. And usually within 60 to 90 minutes, your urine turns clear again. And this means the full dose of yellow B vitamin flushes through you in about 60 to 90 minutes. Our slow-release bioactive B complex contains only the already active forms of each B vitamin and is formulated in a slow-release form. You take 2 capsules in the morning and you will still pee yellow when you come home late afternoon. This way you are maintaining blood levels of all the Bs throughout the day, and your fine nerve endings will thank you. So another condition that responds well to a nutrient is postherpetic neuralgia. This is a pain caused by shingles, where the herpes zoster virus starts multiplying within peripheral nerves. You develop a patch of herpes blisters, usually on the chest, the side, or your back. And these painful blisters last 2 to 4 weeks in most patients. But in some cases, the pain can persist well beyond the healing of these blistering lesions, making things like sleeping, movement, or even simply wearing a shirt very painful for months and sometimes even years. So here's some interesting research on vitamin C. One analysis of 50 postherpetic neuralgia patients found that they had significantly lower concentrations of vitamin C in their blood, compared to what was measured in 50 healthy subjects. Meanwhile, acute herpetic and postherpetic pain is significantly reduced with high-dose vitamin C administration. And there was another study that found that vitamin C infusions given intravenously at around 7.5 grams 2 to 4 times weekly for just 2 weeks showed a reduction of pain by 2/3 within 2 weeks. And the overall decrease in pain was noted by 92% of these patients. So that's very successful. And many NDs, naturopathic doctors, offer IV vitamin C services, and I always emphasize to consider getting them at first sign of shingles, not just when postherpetic pain has fully settled in. Vitamin C has potent antiviral properties, so a few IV applications can not only shorten the acute shingles outbreak, it could also prevent the actual development of postherpetic neuralgia. If IVs are not available to you, consider using oral vitamin C at higher daily doses. All our vitamin C products are corn-free and made from tapioca. And similar to B vitamins, vitamin C is also water-soluble and flushes through us very quickly, which is why our vitamin C 1000 slow-release product is so popular and effective. I would suggest 2 caps 3 times a day. If you are using regular release vitamin C capsules or our vitamin C powder, I would suggest 1 capsule or scoop every 2 hours throughout the day. And some NDs, naturopathic doctors, recommend much higher oral doses per day. You know? So I hope this information was of value to you. Everyone registered will receive an email with the link to the recording of this webinar in the next couple of days. You can also very easily share this link with others if you find somebody might benefit. It'll also go up on in the webinar section of our website and our YouTube channel. You just have to enter Pure Lab Vitamins in the YouTube search bar and all our videos pop up right there. Thank you all for your time and interest. I'd like to now thank all our participating retail partners that help promote this event. Most of them have specials going on for the next few days in support of this event. And I'll now get ready to check if there are any questions coming in. I'm sure there are. So please just give me a moment and stay tuned. I'll be right back. So this was short and painless. Normally it takes a little while till the questions are starting to pop in. I'm very sure there will be lots of them coming, so don't hesitate to give me a brief description of what you're dealing with, and I will do my best to answer as efficient as possible. You can imagine that I could have stood here for 2 hours talking about pain condition after another with always leading back to the same kind of recommendations. So I thought it's much better to answer specific questions. And here's one question from Anonymous. Are there any specific supplement recommendations regarding osteoarthritis pain? I believe there are. As we just learned, magnesium will always kind of calm and inhibit the NMDA receptor in a chronically osteoarthritic joint. The information is told to the brain initially acutely, but then also gets switched over to the C-fiber network. So providing magnesium and glycinate there will have an impact on perceived pain levels. Vitamin C also protects tissues, helps with more or less support of cartilage and connective tissue development. B-complex keeps the nerves kind of intact and healthy. I would, whenever we're talking about osteoarthritis, which is the non-rheumatoid autoimmune type or non-autoimmune type, I would highly recommend to read up on pH balance or alkaline therapy and learn about how diet affects your physical pH, and then start with diet, lifestyle changes, and potentially use our product AlkaPure to potently shift your body pH into more alkaline ranges, and that will then very effectively kind of reduce the release of so-called pro-inflammatory cytokines, and with that reduce inflammation, which is the starting point of osteoarthritis. So that should be looked at. We also have I believe there's a webinar on alkalinity on our website, so you could look that up to get some further information there. There's a question from Kroll whether high dosing of slow-release vitamin C could cause bowel movements. Absolutely. There is a phenomenon called vitamin C flush that is happening at very individual vitamin C levels. Some people respond very early at 2, 3, 4, 5 grams per day, where some others might have to use 50, 75 to 100 grams of vitamin C per day to reach a vitamin C bowel flush. It's a very drastic bowel movement. You don't want to be far away from a bathroom there, but it's usually in much higher daily doses as you would use to kind of provide antiviral support or kind of aim for support in postherpetic neuralgia, where we talk about 2 capsules slow release 3 times a day. The slow release formulation also prevents one big peak of vitamin C and then a quick flush. You're actually maintaining lower blood levels but more constantly. So the danger of developing a vitamin C flush on a normal dose vitamin C slow release therapy is very slim. You can also, it's actually quite an interesting trial, first of all read up on vitamin C flush protocols or talk to your naturopath, because in a way it can also give you a bit of a tidbit about yourself, because if you're in the group that could tolerate very large amounts of vitamin C orally, it also kind of indicates that your full body requirements are somewhat higher, and you would in kind of titrating up to that dose of bowel flush also make sure that your system is fully replenished. Okay. Anonymous asks here, what can be used for chronic pain, spinal pain, tired of prescription drugs? I believe that this whole approach here that we just discussed would potentially help you reduce prescription drug requirements. Whether it will be as successful that you can get rid of prescription drugs needs to be tried. I believe that in many pain patients, the actual initial injury or trauma has long healed or is long kind of dealt with. But somehow the body got so used to triggering NMDA receptors that, that chronic pain persists, even though the actual injury is long kind of a thing of the past. So breaking this vicious cycle, magnesium glycinate can be very helpful in this scenario. Also, I always tell a bit of a story that especially when there was true injury or trauma, or maybe surgery, a cut of some sort, which caused like chronic pain, that many times the brain tells the surrounding muscle groups to hold tight to prevent further pain, to stabilize the area. And these muscles are being told on and on and on and over and over and over and all day long to hold tight. And they're gonna get tight. And that means they're using up their relaxing reservoirs. That means at some point these muscles start radiating pain, and the actual pain site on the inside of this area has potentially long healed. So in this kind of scenario where muscle pain is kind of mimicking the previously present chronic pain, stretching, exercises, deep tissue massages are just as important as replenishment of these tissues with adequate amounts of magnesium and B vitamins, hoping that all these muscle groups can at some point fully relax, and actually pain to a significant extent could resolve. So, but it's a trial and error approach for sure. Here's a question from Dorothy. She asked, I have arthritis in my thumbs with chronic pain and sometimes acute. What can I take? I would assume in your thumbs that this is also osteoarthritic, which means it's like a systemically caused chronic inflammatory condition. Icing is quite helpful. pH control is quite helpful, meaning that you should read up on pH balance or alkaline therapy. Check out the webinar on this topic on my website. There's also a couple of videos on our YouTube channel surrounding alkaline therapy, and I believe we have another webinar or training video in the pipeline to be made later this year. You could also, especially in the thumb, consider other herbal anti-inflammatory remedies like curcumin. It comes in a variety of formulations, most of them emulsified to enhance bioavailability. We at PureLab don't carry a curcumin product, but would be worth a try. You'd have to decide to use a high quality, high bioavailable type, and then also initially start a somewhat higher dose to kind of see results and then judge the efficacy of that approach. Anonymous asks, what helps neuropathic pain from spine into foot? So that's sciatic, if it kind of shoots down that way. Numbness and tingling in the toes. That's exactly what I described in the video. So bioactive B complex, slow release, high dose magnesium initially are the two key supplements here. but especially with sciatica, you'll have to, or you should, consider doing daily or twice or 3 times daily specific stretching exercises. If you loosen up the area in that L4, L5 region so that the compression is reduced, the nerve will thank you and you will have less pain. But it requires you to do these exercises and do them well. Once you kind of advance with these initial stretching exercises, you can further consider going into quite regular yoga sessions that focus on lower back pain, sciatic pain. They're all available on YouTube. You can do them at home. I think, though, that initially it might be helpful to actually visit a couple of like one-to-one or even small group yoga sessions to truly learn about how to do this right. Yoga is amazing. And having a yoga teacher that can focus on your requirements specifically can be very good. But then it's up to you to actually do the exercises. Rita is asking, any recommendations for plantar fasciitis? Please, she writes. And yes, plantar fasciitis is a prime acidity condition. The body metabolizes all kinds of things into acids that normally get excreted. Stress, diet, and lifestyle elevate acidity in the system. And if you kind of, over the years and decades, accumulate more and more acidity, these acids fuel the release of pro-inflammatory cytokines. And these initial inflammatory conditions usually occur first in the periphery. That's why osteoarthritis usually starts in the hands, or plantar fasciitis starts in the furthest peripheral region, the feet. That's why we have gout in the big toes. All chronic inflammatory conditions fueled by acidity. So alkalining your system potently, together with dietary and lifestyle change that also aim to alkaline you, this will take 2-3 weeks, and plantar fasciitis is gone. And this can always be also assisted by B vitamins and magnesium. There's Stephen asking, solutions for pain caused by cysts on forehead or head. That's a unique case. I think I would need to know more about this. Maybe email me at info@purelabvitamins.com. I need to get a bit more detail here as to what kind of pain that is. Happy to get your email. There's John from Well. Oh, he's asking how many of the slow-release B vitamins per day would need to be used for neuropathy to be effective during neuropathies. With the slow-release formulation that we make, you don't need much. I would use maybe 2 in the morning and then another booster at lunch, just 1. So total of 3 a day. You do not want to take B vitamins, especially that potent bioactive or those potent bioactive forms, too late in the day, because you might not sleep well, even though many of my clients can use a full dose B complex at night and still sleep well. But there's just as many that would be fully wired into the night. So you got to figure out whether it affects you this way or not. In that case, you could take maybe a 4th capsule in the evening if it doesn't prevent you from sleeping, but there's not more necessary. So 2 to maximum 4. And most likely better breakfast and lunch, and then also do your exercises in the evenings to loosen up everything. Kroll says thank you Kroll. Anonymous asks, what supplements do I recommend for osteoporosis? I've worked with hundreds of women in the pharmacy that kind of came to me with prescriptions with Fosamax, alendronate, Actonel, Didrocal, and so forth. And some of them I assisted over long periods of times. And then I finally recommended for them because I didn't see any change. Maybe a slowdown in progression of osteoporosis, but not a real change. Once I kind of convinced them to give pH balance a try, they actually Many of them got off the osteoporotic drugs and then went on diet and lifestyle changes together with AlkaPure, and within 6 months their bone density actually started to rise. pH balance is hugely affecting our bones and mineralization of the bones. I would even think that while you still are acidic, makes no sense to use large amounts of calcium as a supplement, because while your body is still acidic, your bones are still spilling their calcium to help balance systemic acidity. Why would you think that supplemental calcium taken on top of that would go back into the bones at the same time? So by starting to increase or balance acidity in the body more efficiently, first of all, you stop the leaking or leaching out of calcium and other minerals from the bones, so that actually it stops the progress right there. And if you then introduce proper doses of vitamin D3, K2, MK7, and maybe low-dose calcium, you will slowly actually increase bone density. Following medical doctor advice and take 12 to 1500 milligrams of calcium no matter what at any time of your stage in life is, from my point of view, quite detrimental or can even be dangerous, causing constipation, causing tightness and calcifications all over your body. So alkaline first, learn about how food and lifestyle affects you from a pH point of view, address the issues, change your diet, exercise, and alkaline, and then your osteoporosis stops and gets better. June is asking, what do you recommend for bursitis of the knee, which is when the bursa is producing too much liquid to the point where the knee is actually pressurized and quite painful. I speak out of my own experience here. I think that oftentimes the calf muscles and also the IT band and thigh muscles are involved here, and they could use some intention to loosen up and improve circulation of the greater below, in and above the knee area. I believe that if it's acutely painful, you have to most likely puncture and withdraw excess liquids, which gives you instant relief. I actually, at some point, I was hobbling on crutches into the clinic, and 10 minutes later, after they withdrew 110 cc's of liquid out of my knee, I walked out. That was quite amazing. I believe that pH control in this case also kind of helps and should be looked at. It depends how damaged the cartilage and meniscus is, and because that also affects or triggers inflammation, which could then trigger the bursa to continue to produce more and more. There is, depending on severity, at some point, if you want to maintain an active lifestyle, which I think is always the goal, you can't just because of a wonky knee stop exercising, which kind of creates a lifestyle vicious cycle down. You might want to consider cortisone injections. I believe that they are the lesser evil when if they allow you to stay more active and maybe train those muscles, become more active, improve circulation, and but it needs to be considered individually. I hope that helps. Wow, we have questions coming here. Sandra is asking, what would you recommend for someone suffering with rheumatoid arthritis, which is an autoimmune chronic inflammatory condition? And you might think that since it's autoimmune, there's nothing you can do, but I believe that practically the same measures apply for rheumatoid arthritis compared to osteoarthritis. And that includes general, help the NMDA receptors to be less sensitive with magnesium and glycinate. B vitamins are always important, not just from a nerve end protection point of view, but also to help with detox, processing of sugars, and many other functions in the system, energy production, and. But the key here, I also find, is pH control, meaning alkaline therapy, dietary changes, learning about what is your status right now in regards to pH by using pH test strips, and then kind of work your way to a more balanced alkaline pH around 7. And with that, even though the condition is caused by an underlying autoimmune mechanism, you reduce the pro-inflammatory neurotransmitters or cytokines, and with that, your body will be less inflamed. I hope that gives you an idea. John is asking, magnesium malate has been researched for fibromyalgia. I mean, fibromyalgia is a long story, a very drastic condition. Patients suffering from this condition are oftentimes very depressed because nothing they really do can help. Magnesium malate is a magnesium bound to an organic acid, malic acid. From my point of view, that is pro-acidic. It makes you more acidic. It will backfire. It is secondly also not as well absorbed as magnesium glycinate, magnesium bound to an amino acid. In the olden days, we believed that, let's start this way. In the olden days, fibromyalgia was always kind of diagnosed simultaneously with chronic fatigue syndrome. And in those days, people were thinking that if we would provide the citric cycle intermediates that kind of are generating the so-called citric cycle, the energy production cycle, we would provide magnesium and fuel for the citric cycle to provide more energy and with that kind of fight the chronic fatigue portion of this condition. And today we know that neither malate, fumarate, oxaloacetate, ketoglutarate, or any of these citric cycle intermediates in higher doses doesn't do anything to the energy levels. But on the other hand, you're adding more acidic metabolic waste into your system. To me, magnesium malate is good magnesium bound to metabolic waste. Enough said. You're much better off using glycine or glycinate because then you get energy producing properties from the magnesium, which is involved in many of the steps of the citric cycle, but you also get the pain inhibitory properties of magnesium and glycine. And glycine itself, it has countless different beneficial factors. It's anti-inflammatory, it is calming, it's a part of glutathione, which is a hugely important component in our immune systems, and many more. And the actual metabolic functions of malic acid are practically zero. So yeah, rather dose up glycinate and save your money on malate. Anonymous is asking, how can I prevent the pain that comes from long-time GERD? GERD is gastroesophageal reflux disease, oftentimes a very lingering condition. Most people are on PPI drugs anyways, the kind of the last drug I would want to be on. And here also alkaline therapy can be very, very helpful. Not just in the acute neutralization of gastric acid. Many GERD patients don't really have serious reflux symptoms, but then over long term they develop like painful conditions of the esophagus, either at the lower sphincter or even at the upper sphincter. And that can cause all kinds of problems, almost like backsplashing all the way up and into the larynx, causing voice changes and the like. And it feels like everything is on fire the whole time in chronic long-term GERD. To me, this is still a systemic hyperacidity condition. And in those cases, I would use Alka-Pure at full dose away from meal times. That is very important to use this natural antacid away from meal times, because gastric acid is the only good acid in our bodies because we need it to break down and process food. absorb minerals, alkaline minerals, and bring them in. Without gastric acid, not much of that would be happening. So by using AlkaPure an hour, hour and a half after meals, you at least expose the food to gastric acid for this long, and then you potently kind of send in a alkalining dose into the system, and it gets absorbed into the blood and helps neutralize and balance blood pH. But also it pushes through into the lymph system, in the connective tissue, into the periphery, and helps the whole body become more alkaline. And that then has more soothing effects on the GERD as well. Takes a bit of time. Takes time. AlkaPure can also be used to help wean off the PPI drugs. And there's a protocol for that as well. That's interesting here. Anonymous is asking a recommendation for a facial neuralgia, nerve damage from dental surgery. Poof. And he's asking, phosphatidylcholine has been recommended to repair the nerve. I think there's really no downside in trying that. Nerve cells are very fatty cells, and phosphatidylcholines or cholines in general are a big part of the membranes in nerve cells. I would not think it is the only way. You can get phosphatidylcholine either by itself in pure form, or it is part of lecithin. So you could use lecithin capsules to provide other fatty phosphates as well, which are part of the nerve cell membranes as well. So that might be helpful. But I would always also include B-complex vitamins. I have heard during my compounding time of injections of B12 right into the general areas along the nerves, but that needs to be discussed with a practitioner that is experienced in that field. I would think that therapeutic dosing of magnesium might give you some pain relief. But I mean, if it's really nerve damage from a cut, it can be difficult. No? But those are the things I would consider. I've also kind of seen vitamin C injections into facial nerves, or into the general area as well. But again, you need an experienced practitioner here, for sure. Gail is asking, why should B vitamins only be taken for 8 weeks? That is a cautionary note that Health Canada kind of requests to be put on any B complex or multivitamin with like more therapeutic doses of B vitamins, and that is reflective of the only B vitamin that can actually get overdosed, and that's B6. But in order to get into the more dangerous ranges of vitamin B6, you would have to use something like 1.5 to 2 grams of vitamin B6 on a regular basis, like for quite some time. And with the B complex, with 2 capsules, you're getting 40 milligrams of P5P, which is pyridoxal 5-phosphate. So if you're taking 3 or 4 B complex vitamins max, you're nowhere, you're not even scratching the surface there in regards to vitamin B6 danger. So, but as a manufacturer of supplements needing to get an NPN number in Canada for any given product, I need to comply and put this cautionary note on my label, even though if you'd ask me, I would not put it on. John is asking then again how magnesium glycinate compares. I think it was in regards to the previous question to use magnesium malate for fibromyalgia. I believe I answered that. There's many reasons to use glycinate over malate. Here's Melody asking, I have scoliosis in my lumbar spine along with osteoarthritis. My physiotherapist is of great help. Absolutely. With the scoliosis and again osteoarthritis, I mean, on the one hand, for sure, read up on alkaline therapy, Alka-Pure use and dietary changes to reduce acidity in your system. With the scoliosis, physiotherapy is one great way of mobilizing those areas. I would also consider trying a good osteopath. I'm a big fan of osteopathic medicine. I believe that the mindset of this discipline is very true. They create space in areas that are tightened. They're oftentimes very intuitive practitioners. It's amazing like how they can find the problem areas that you are dealing with without you telling them anything, and it's like takes them seconds, and they see, oh yeah, here is the scoliosis, I can feel that right away, and then they gently start working on releasing those areas, and the effects are quite amazing. So that might be another way, and you could do that aside, parallel to physiotherapy as well. No problem there. Some people shy away from chiropractic adjustments, even though I kind of like those as well. But you need to trust your practitioner and also trust the discipline. Oh, there's another anonymous, and he says, sorry, I joined late, no problem. Recommendations for migraines. Thank you for that question. Migraines was actually one of the first, let's start this way. I started out finding magnesium glycinate because I was compounding prescription compounds for chronic pain patients prescribed by the variety of pain clinics in Ottawa. Kathy Smythe at the General Hospital, Dr. Thompson at the Civic Hospital. I had a connection to CHIO Pain Clinic, and they prescribed creams, injections, all kinds of things. But magnesium was always on my radar. And in the early years of my practice as a compounder, we didn't have much choice other than oxide, carbonate, citrate. And we all knew that, you can barely get enough into the system before you're actually creating laxation. And with that, you lose most of the magnesium again. And then at some point, at one of the pain clinics, I heard whispers about this new kind of magnesium in the audience. And I listened closely and heard about glycinate, talked to one person there, got a source, and bought my first 10 kilos, started compounding capsules, and then it just kind of went from there, and we kind of swamped these pain clinics with magnesium glycinate capsules. Many of these practitioners were actually injecting magnesium sulfate either IV or straight into the muscles to help relax those muscles that were causing pain. And they were looking for an oral form that they could give at more therapeutic doses to maintain the beneficial effects from the injections and kind of extend the time frames between IVs or between injections so that people could stay at home longer without having pain or with having less pain. So anyways, and then I started to use these same capsules in other conditions like migraine. And we used the same experience of trying to replenish a body that we deemed deficient with more therapeutic doses. And migraines is a quite amazing area of chronic pain that responds extremely well to therapeutic dosing of magnesium glycinate. And here we actually use the magnesium bowel tolerance protocol, which means we titrate the dose up to the individual's bowel tolerance, where you start to get way too loose bowel movements. And at that point, we don't stop. We just stay 25% below your bowel tolerance dose, continue at a somewhat higher therapeutic dose until you again get loose or get too loose. Loose is fine, but too loose is not good. And then at some point you kind of find your maintenance dose. But in going through this over-the-hump dosing protocol, you're actually replenishing your deep tissues, your whole body. And my observation was that about 60% of chronic migraine patients practically stopped having migraines. 60%. That's significant. And the other 40%, those were individuals that kind of already knew that their type of migraine was somewhat connected to other issues like hormonal cycles, that the migraines always occurred at the same time of the month. Or other, like they had like other subtypes of chronic headaches, like cluster headaches or other subtypes. But even those 40% saw a significant reduction in regards to severity of migraines and frequency. Didn't go all away, but at least it improved significantly. So yeah, magnesium glycinate for migraine, and I would always include the B complex here as well. Yeah, that was anonymous, and I hope that answers your question. So, therapeutic dosing of magnesium glycinate in chronic migraines, absolutely yes. Another question from some anonymous person: should B complex be taken in the morning only? I think I answered that question. I would use a good dose in the morning. You could reboost at lunchtime with 1 capsule. Again, and only if you know that the B complex doesn't affect your sleep, you could take another dose, let's say early evening. No? But you will learn very quickly whether an evening dose of B complex keeps you awake. Oh, the questions keep coming. Here's a question about mild fatty liver and milk thistle. I think that's not part of today's webinar, but to answer quickly, I would highly recommend to use omega-3 fatty acids. Get prepared for a huge price increase of omega-3 products, because I believe that our oceans are slowly getting empty. And it's going to get very hard to get high quality fish oils or omega-3 products in the next couple of years. Rita is saying thank you, Rita. Oh, that's an interesting one. Anonymous as well. Is asking for leg swelling pain, possible lymphedema and or lipedema. Whenever I see the periphery swelling and causing, or whenever there's chronic inflammatory issues in the periphery, in hands and feet or lower limbs, I look at toxicity. And one way to fairly effectively help the body detox is alkaline therapy, become more alkaline. And this way, organic acids and other acidic waste molecules get made more water soluble in alkalinity. That means they get flushed back into lymph and blood, and that means they can then be transported back to the detox pathways, liver, kidney, sweat, saliva, gland, hair, and actually leave the body. And that would then reduce the edema over time as well. Yeah, but I mean, with swelling in the legs, you definitely need blood work to check kidney function, liver function, and a couple of other markers, and then take it from there. Yeah, Melody had here another comment about the physiotherapist, but I can't say I fully understand it. Yeah, you got to keep doing it. Physiotherapy is a thing just like yoga and stretching and many other disciplines. Yeah, they only work as long as you do them, and do them regularly, which means not just a Friday session. You have to do the exercises during the week, practically daily on your own, and then just get more practice and training with the physiotherapist. Another question from Anonymous here: what is the difference between magnesium glycinate and magnesium citrate? Thank you for that question. Magnesium citrate is a laxative, and it is being used by most people for that purpose, to stay more regular. But as a laxative, it does its job mostly from the gut lumen side because it doesn't get absorbed well. There's some kind of absorption into the blood, but not as much as with the magnesium bound to an amino acid. But the biggest beef I have with citrate is that it also is an acidic organic acid. It is metabolic waste. We have and make enough of it ourselves. We don't need to add on citric acid with a supplement. So, because that makes you over time more and more acidic. That causes deposition of acidic waste in the periphery. It fuels osteoarthritis. It fuels the leg swelling, edema. It fuels plantar fasciitis, just like I explained. And those depositions, the body isn't stupid. It doesn't deposit its waste downtown where all the core organs are. It actually, just like any city, brings its waste to the outskirts. The periphery. That is periphery. That is periphery, and skin is periphery too. It's removed from the core. And that's why hyperacidic individuals usually have very inflammatory skin conditions. Rosacea, psoriasis gets fueled by systemic acidity. Any kind of chronic inflammatory skin condition gets fueled by chronic acidity. So yeah, citrate, magnesium citrate, fuels acidity and shouldn't be consumed in large amounts. And then on the other hand, if you take magnesium glycinate, magnesium bound to the amino acid glycine, you're absorbing more into the blood, which means the gut muscle that is magnesium deficient gets replenished with magnesium from the blood side, which means magnesium glycinate will also fix constipation, but it actually, in contrast to treating the symptom of constipation with magnesium citrate, with magnesium glycinate, you're treating the cause. Huge difference. Another anonymous, does K2 help for osteoporosis? Absolutely, but especially if your body is not too acidic, because while you are acidic, as I explained earlier, your bones help, or they try to help balance acidity. So they sacrifice their alkaline minerals back into circulation to help systemic acidity to be neutralized. So in those instances, while you are chronically highly acidic, K2 MK7 will not help significantly. But as soon as you alkaline the body, then D3, K2, and a little bit of calcium can actually do the job and re-cement the bones and make them more dense. Patty is asking, what do you suggest for muscle cramps in the legs at night? Cramping and restless legs, magnesium, and I would also recommend to check your iron levels. When you actually Google restless leg syndrome, the first thing that pops up is iron deficiency. And Patty, as I would assume, a female, I would get your iron levels checked. If your ferritin levels are somewhat okay, above 30, between 30 and 100, then you can rule that out, and then you just use magnesium glycinate at bedtime to stop those muscle cramps. Here's a question, what supplements are good for scoliosis and degenerative disc disease? This person already uses 1 magnesium glycinate a day and has started to use 2 a day. I would use more. Find out where your bowel tolerance is and dose up to that tolerance, replenish your system. That keeps all the muscles along your spine and your whole torso more loose and flexible. It doesn't fix your scoliosis and it doesn't fix your disc disease per se. But it will help keep the muscles loose, and with that you stay more flexible, and then stretching and exercises can help with the scoliosis and disc disease, but it is very unlikely that any supplement will help you fix these conditions, or at least not bring them back to normal. No? You have to start maintain mobility and reduce pain, so that you stay active and mobile for as long as possible. And I think that magnesium glycinate would be a great, at higher doses, would be a huge help. This person also asked whether, what about L-theanine? Or are there any others I might advise? Well, L-theanine helps you to be less stressed and be more relaxed. I do not see a direct scoliosis or disc disease connection, but it might help you sleep, and that helps reduce stress and recovery, and that helps you stay more alkaline or less acidic. So there might be an application for L-theanine during the day and at nighttime. I would also at least measure your body pH in saliva or urine and see whether you are on average like somewhat more significantly acidic, and in that case then counteract that with diet and lifestyle and maybe AlkaPure to become more neutral. That's it. Stephen is asking whether neem, natural eggshell membrane, would help to rebuild cartilage for osteoarthritis. I would see neem to be a somewhat herbal anti-inflammatory, could be used and tried, absolutely. And eggshell membrane has been studied in a variety of conditions, including arthritic conditions. But I mean, I've been in this industry now for a good 25 years, and if you look at the claims about eggshell membrane, it would be a blockbuster supplement, but it clearly is not. So you can try it and see how it works for you. I'm not saying it doesn't, but I think it would be an individual trial. I would highly recommend to get proper dosage recommendations and follow them accordingly to see whether you get the promised benefit from that. Nyosha. Yes, this webinar is recorded and it will go up on our website and YouTube channel, and since you registered for this, you will get an email with the link to the recording. Tina is asking, hi Tina, how many B-complex capsules would you recommend for someone experiencing tinnitus? Tinnitus is a condition quite nasty where the middle ear is most likely calcified and you're hearing a constant beep sound, and can also go hand in hand with vertigo oftentimes. And in this case, I would just spread out the B-complex and see how you can use it towards the evening. Maybe take 1-3 times a day to provide really nice stable blood levels throughout the day, and see how that works, and keep an eye on your ability to sleep. If there is any evidence of calcifications in the middle ear being the cause of the tinnitus, then you could also consider using high-dose vitamin K2 MK7 and AlkaPure to alkaline the system, and with that make calcium more water soluble. And also, especially the vitamin K2 MK7 form is the one that got researched in its ability to actually degrade calcium deposits within the cardiovascular system and bring it back to the bones, or give it to vitamin D to build into the bones. And K2 MK7 is the only vitamin K that shows promise to do so. So that might be interesting as well, and I would check with a naturopath on how high you can dose K2 MK7 properly. Rita is asking some post-COVID recommendations regarding a chronic barking cough, most likely caused by a post-nasal drip, not post-COVID. I kind of read post-COVID here. Well, I would do actually a neti, not a neti pot, but a Neomed rinse kit. If there's lots of mucus in your nasal cavities, using a neti pot and hope that gravity takes the saline solution through your nasal cavities is a bit more than like wishful thinking. But the Neilmet rinse kit is a squeeze bottle. You can actually build pressure, and you kind of flush saline solution up one nostril through the caves and cavities and out the other. The trick is that and it's kind of a funny sensation initially, you're standing in front of the sink, you plug in the squeeze bottle, and then gently start. See, I'm losing my post-COVID voice here. You gently start squeezing, and then when the saline solution runs out the other nostril into the sink, you start exhaling through the open nostril. And that creates vortexes of air and saline solution, and it truly cleanses the sinus caves. And all kinds of funky stuff comes out, and you actually experience a real nasal flush, which will calm down the nasal mucous membranes. Less mucus is being produced. You, over time, and fairly quickly actually, you will have less post-nasal drip. Yes, humidifiers definitely are a thing to consider. I would also get a device to actually measure the humidity in your home in specific rooms. If you're working 8 hours a day somewhere in an office, definitely check the humidity there as well, and then maybe even get a humidifier for the workplace as well, because you're spending a lot of time at that place as well. One other way to effectively reduce the viscosity of any kind of mucus and also rebuild glutathione levels within your respiratory system is the use of NAC, N-A-C, together with selenium or selenomethionine. NAC is a quite amazing supplement. It provides cysteine, a sulfur-containing amino acid, and the N-acetylcysteine form, NAC, is the one that actually breaks mucus polysaccharide molecules into, like, it breaks up the network between the mucopolysaccharides, which means the mucus gets less viscous and actually can be blown out or flushed easier. But it also rebuilds glutathione. It's part of the tripeptide that makes glutathione, together with glycine and glutamine, I believe. Yeah, and that has hugely healing properties on mucous membranes, and especially after any kind of chronic viral infection, our body's cysteine reservoirs are very likely deficient or depleted. Yeah, so the Neilmet rinse kit, humidifiers in every room that you spend time in, and then maybe NAC at somewhat higher doses. I would maybe start at 2 caps 3 times a day. There's also a very interesting dosing development with NAC that I find interesting. And where we take magnesium to bowel tolerance, or vitamin C until we truly flush to determine the body's intake capacity, you can take NAC until your farts smell like sulfur, because the sulfur in cysteine will get at some point released as sulfuric farts, and that's the way it is. So you can actually titrate your dose up to the point where those bowel movements get very interestingly stinky, and then dose down. There's no other danger of high dosing of NAC in any way. Here's a question from Anonymous regarding osteoporosis. Is it better to take calcium hydroxyapatite compared to other calcium types? Well, I think so. That's why I came out with the calcium hydroxyapatite. It's actually purified bone meal and calcium hydroxyapatite compared to synthetic, fully synthetic forms of calcium carbonate or calcium citrate. Does not just contain calcium, it also contains phosphates. It contains and quite significant amounts of phosphates, and practically all kinds of bone matrix proteins and other components that are naturally present in bone. It also contains a natural distribution of trace elements that are normally present in bovine bones. No? So from that angle, calcium hydroxyapatite is certainly to be preferred. But calcium citrate also contains the citrate that we talked about, which is an organic acid acidifying you. Bioavailability is not as good as with hydroxyapatite, and you're adding on to the overall metabolic acid load that nobody needs practically. General dosage recommendations for calcium don't, from my point of view, unless you have lab work evidence that you are in drastic need of calcium, do not take 1200 to 1500 milligrams of calcium elemental per day. No? Especially not if you're still consuming some level of dairy or dairy substitutes which are all calcium fortified. I believe that somewhere between 250, 500, maybe 750 milligrams of calcium per day is more than enough. No? And if you're then at the same time using a calcium that is well absorbed and provides all the other trace minerals as well, like calcium hydroxyapatite, you're doing more than what the other kinds would ever achieve. No? Okay, like that. It doesn't let up here. My hunch was right that I should spend more time on questions. Somebody's asking about my GERD Alka-Pure recommendation. Did you say to take it each meal, 1 to 1.5 hours after? Well, no, the dosage recommendation for Alka-Pure on the label says 3 capsules twice a day. So you would take, for example, your first 3 capsule dose an hour and a half after breakfast. You could take the second dose after dinner or at bedtime. No? And then only in very acute chronic inflammatory conditions like gout do I recommend to use 3 capsules 3 times a day, but only for 1 week, and then goes down to 6. No? So you would use 3 caps of Alka-Pure after breakfast, after dinner, and at bedtime, but just for 1 week, then go down to 6 a day or 3 twice a day. I hope that makes sense. Well, that's interesting. So this anonymous attendee takes 6 magnesiums a day and is still constipated and suffers from mild restless legs at night. But at least the restless legs were so much worse before he or she started the magnesium. So that's good news. So you're on the right track. But it indicates to me that you are more severely deficient. That means even on the 6 capsules, do you not replenish your system adequately yet? So I would recommend to dose up. And dose up to the point where your bowels will tell you, hello, this is too much now, I can't take that much in anymore, I'm going to flush it. And you're getting looser stools. You're not going to be toilet bound or so. So obviously you're not taking 6, 8, 10, 12 capsules in one shot. You're spreading it out over the day. But you will slowly increase your daily intake until you reach your bowel's tolerance. And then you don't stop, you cut back by 25% of your peak dose. For example, if you manage to get up to 16 capsules a day, which is possible and almost normal in our depleted society, no? Then you cut back by 4 capsules, 25% to 12. Stay at the 12 level for as long as it takes until you get loose again. No? You're still replenishing. And at some point you can cut back a 3rd time and you will find that you stay loose and regular by using only 2 to 4 caps a day, which is normal maintenance dose. But in order to get to that point, you have to replenish first. I always bring up the example of a car. Beautiful comparison to the human body. If you know you're going to be driving 100 kilometers tomorrow, and you put 10 liters of gas into your tank, you will make it to your destination. But at the end of that day, once you reach the destination, your tank is empty again. If the RDA for magnesium is 3 caps a day, which is an average, and you're starting out empty, you put 3 capsules of magnesium into your tank, yeah, you will do better. Your restless legs is improving. But at the end of that day, your tank is empty again. You have not changed the underlying deficiency in any way. So in order to do that, you have to provide your daily average, your daily requirements, plus some extra to replenish your tissues. You can't just take 50 capsules because your bowel will tell you that's too much, right? But you have to slowly, in increments, replenish your system. And the bowel will tell you when you kind of get there, and then you dose accordingly. And at some point, you will end up with regular looseness, and your restless legs should have resolved by then as well. There's somebody asking for suggestions for daily headaches for 2 years. Yeah, magnesium. To bowel tolerance. Same thing. Just do it. There's something that I'm not familiar with, an anonymous question about Ehlers-Danlos joint hypermobility pain. Please email me and I will look it up and give you some ideas. Anonymous is asking for the sister-in-law with chronic pain in the lower spine since a car accident 20 years ago. Wondering if there's anything she could do to help. She's in her 40s now and it's much worse. She's looking for some relief. Well, with this injury from 20 years ago, the muscles surrounding that injury are at this point in a state of spasm. Poof. That generates radiating pain in all kinds of other tissues. So yeah, magnesium replenishment, B-complex vitamins, and as much gentle physiotherapy, stretching, maybe massage therapy, all at the same time as possible. And initially very gentle, and then hoping to actually remobilize this whole system over time. I find it also quite interesting. I always recommend for somebody dealing with very severe muscle spasms and tightness to actually use a good dose of magnesium just before physiotherapy, just before yoga, just before massage. No? Because then your blood levels are elevated and high, and then the exercise or the manual manipulation will pump this magnesium-loaded blood through those muscles. And that helps. No? You can imagine a muscle that is tight and in spasm is not really being circulated well. So you can take magnesium orally, hoping that it would relax this spasm. But look at my fingers turning white. There's not much blood circulating in this spasm right now. So you have to manipulate it, open it up so that fresh blood can flood in. And if that blood then contains more magnesium, this muscle will stay more relaxed longer term. And then with proper stretching and exercise, you're actually keeping it mobile and pain levels go down. Yeah, somebody is also raving about osteopaths. They're truly incredible. Yep, I agree. You got to find the right ones though. There's somebody asking about recommendations for angina pain. This is heart. Yeah, and you said, I've been told magnesium is helpful. Absolutely. The first thing you get into, if you get into the emergency with radiating heart pain into the left arm, you get an IV of magnesium sulfate without any other question asked. So yeah, use continuous amounts, daily doses of magnesium to prevent this. But I mean, you also have to look into other factors here. which is calcification, sclerosis, atherosclerosis, as well as maybe your cholesterol levels, but that's a can of worms here. Exercise daily, and look, work at the whole thing, not to be fooled around with. Aurora is asking, do you mind repeating the therapeutic dose for magnesium for a diabetic? Well, since this is, like, depending on how many years the person was dealing with diabetes, depending on how severe the potential late effects of diabetes are in this individual, I would consider a therapeutic replenishment. And for that, you could use 6 to 9 caps a day, or until your bowels tell you this is too much, and then cut back to just regular maintenance dose of 2 to 4 capsules per day. I would always use, once you get to maintenance, I would use the majority of my daily dose towards bedtime, because magnesium is so blissfully relaxing and helps with sleep. So you might as well take advantage of that. But any diabetic that has been dealing with diabetes for a number of years should get replenished. And then also B-complex vitamins, start them right away. Oh, somebody's thanking me for the migraine recommendation. He or she. Well, if you like, email me at info@purelabvitamins.com to get further advice here. He or she is dealing with, on average, 15 migraine days a month. I'm very confident that we can change that. The thanks are coming in. Thank you guys for your time. Keep up the great work. Thank you. This person is asking whether the therapeutic dosing of magnesium and B-complex is on my website. No, it cannot. I'm even kind of leading myself far out the window by talking publicly about this, but I always do and always have. But I can't print it on anything because it's information that is not compliant with Health Canada. I normally always recommend to kind of consult a naturopath or a knowledgeable medical doctor, when attempting these therapeutic dosing protocols. But with magnesium, I've done it for so many years, and with thousands of people with significant success, I feel comfortable talking about this. But you won't find it spelled out anywhere on public media, at least not from me. That's a long question. Give me a second. So this person has a weird vibrating feeling in the left leg for the last 5 years. He or she did imaging, talked to doctors who said they could not find anything, but it happens when my leg is resting. Is that restless leg syndrome? No, not usually, but would magnesium help this? And which kind? Normally restless leg syndrome is really restless legs, like you have these jerking movements. When you're lying in bed, the spouses don't like it because they get kicked all the time. But it could be some kind of in the bigger realm of restless legs, and I would certainly try B vitamins during the day and magnesium glycinate during the day and at night. There's nothing you risk, you can only gain from this. And I would also kind of look, maybe with an osteopath, into your overall muscular situation of the lower back, the glutes, the IT band, and everything on the left side, to see whether there's anything that can be loosened up. But yeah, magnesium and B-complex, most certainly worth a try. Stephen is asking if glutamine is also useful for pain management. I would assume that you ask this because glutamine is the actual neurotransmitter for the NMDA receptor, or glutamate. And I mean, we know that glutamine is used very successfully in any kind of chronic inflammatory gut condition. It's a nice anti-inflammatory for the mucosa of the bowels. Specifically in pain management, and from the NMDA angle, I would say no, but from an anti-inflammatory point of view, I would say yes. Depends on the type of pain you're dealing with. Would need to be discussed in detail, I would think. Christina is asking whether I'll be doing a webinar to teach more specifically on alkaline therapy. Absolutely, it's actually in the plans, and there's a couple already out there. One is aiming towards, like we're talking more towards skin health and alkaline therapy. But it's like the whole explanation on why this works for the skin is just as valid for the joints or for any other chronic inflammatory condition. So you could find that on my website in the webinar tab. Another question here on supplements that could help with leaky gut, which may contribute to many issues, including pain. Absolutely. From my point of view, leaky gut is a very complex condition. Just a quick explanation. It's not that something is leaking into the gut. It's actually gut leaking into other tissues. Unprocessed proteins are being released into the bloodstream that shouldn't. And that can then cause all kinds of domino effects. Glutamine, we just talked about that, is hugely important. I'm sure you know about that. You could also consider, since curcumin is always so hard to absorb. I always emphasize that if you take a curcumin and only a small portion is actually reaching the blood, the rest would stay back in the gut and cause or provide anti-inflammatory properties for the gut. So glutamine combined with curcumin are two strong recommendations. Vitamin D in therapeutic dosing, I think, is very important for the mucosa. I think if leaky gut has been diagnosed, you also have to look at food sensitivities, because there has to be a reason why this gut is so inflamed. And there usually is a food trigger or a number of food triggers, and they need to be identified and then for some time taken out of your diet to allow the gut to heal. And because if you keep continuing eating those foods that trigger your inflammatory response, it's not going to change no matter what supplement you use. So that definitely is important here, and there's many very good naturopaths across the province, across the nation, that specialize on that. Christina is asking, how do we test our body pH? Fully explained in the alkaline webinar. We normally use pH paper or pH test strips and test saliva or urine very quickly, because it's very important. One test is completely useless because it only gives you one snapshot. You actually have to test 4 or 5 times a day and calculate your average. If your average is in the range of 5 to 5.5, you are very acidic, and you're aiming to bring that up to 7. 7 is the neutral point, and you don't want to alkaline much further, because then you're kind of getting on the other problem side of too much of alkalosis, and that's not good either. There's an anonymous person that wants to know if I have been vaxxed and how many times, and I will publicly tell you I'm not going to tell you. It's my personal thing, and I'm not talking about that. I hope you understand. There's Rita saying she uses the NeoMed rinse kit and loves it. Thank you for your recommendations, and very funny. Oh, that's the sulfur farts, yes. And interesting about NAC. It is, and it works amazing. Like there's so many mechanisms where our body actually helps us in determining therapeutic dosing. It doesn't work for every vitamin, but for some it does. This person is asking or saying she doesn't want to get knee replacement surgery. What is the best thing for arthritis in the knees? The knee is one of the biggest joints we have. It carries a lot of weight. It gets a lot of abuse. There might be damage that happened many, many years ago, and you're now experiencing the late effects of it. It needs to be looked at. There's... And I wouldn't certainly, us humans, we never lived this long. Like average life expectancy, even just like 70 years ago, was like 30 years less. And now we're running on these knees for that much longer. And we're not moving as healthy as we used to 70 years ago. We're sitting around too much. We're sitting in cars, we're sitting at work, we're sitting. And then all of a sudden we jump up and we expect everything to work just peachy, and we don't exercise sufficiently. Now it's the way it is. Now we live in this world the way we live in this world today. And so I can't really, unless you need to get imaging done and kind of get an idea what's really happening in your knee, and then make informed decisions. I would not shy away from a knee surgery if it allows me to stay active for the next 15 years. Because if I sit at home with a painful knee and I can't exercise because of it, I'm losing time. I'm losing active time. I'm losing joyful time. I can't travel. I can't do whatever I like to do. Skateboarding, surfing, snowboarding, whatever. Those are the things that keep us active, healthy, and happy. And with a knee that doesn't work good enough, you not do anything of that, and you're actually just getting more and more sedentary, and you get sicker. So you got to weigh where you are in life, where you want to be, and I would not shy away from surgery if it actually buys you 15, 20, 30 years of activity, of joyful activity. Gotta think about that. Yeah, I answered all that many times over. That's a long one here. Ruth is asking a complex question, but I don't fully understand it. I assume that you had an epidural 4 years ago, and since then you experienced lower back pain, because you write 4 hours ago, or it says 4 hours here. So maybe email me, info@purelabvitamins.com, and we'll talk about this in detail. We're coming to the end here. There's thank you from Negar. Thank you for your time. Meredith says thank you. Ruth is asking about stem cells for lower back. I think, and I assume you're asking for your husband, a 65-year-old framer with chronic sciatica. You wouldn't have to need to send me X-rays. I'm not a radiologist. I would see the same image that you would see. But osteopathic therapy to open up the spaces, daily stretching exercises directed by the osteopath or physiotherapist, daily, maybe even twice daily in the beginning, without fail. Magnesium will open up the muscles and kind of create the space. B-complex vitamins. Same thing. And I think the framer will be a lot happier with that. somebody asking about help with dental pain, gum issues. I would ask the hygienist there. I believe that gum issues is not my expertise, to be honest. And dental pain, I've seen B12 sublingual tablets to be of help if the dental pain is nerve related. But if it's like because of the common dental problems like cavities and so forth, you gotta fix them. No? Sublingual B12 might be something to look into. That's it. Need to know more. Oh, I think that's Ruth already responding to the dental pain. She's an hygienist and she recommends thorough scaling, cleaning regularly, maybe more than regularly, like initially more regularly than you'd think, and then obviously brush and floss regularly. You know? I have heard about preparations containing tea tree oil for like as oral mouthwash preparations that are quite effective antibacterial to further kind of promote the health of the gums, and they might stop receding and actually then grow back. So that might be something. And then there's a question here. Oh, and vitamin C can also help for gum problems. That comes from Christina, also listening in very much. Thank you very much. Yeah, vitamin C. You could use vitamin C powder and make. Excuse me, I'm losing my voice. Make a solution and then just swish with that. But here was one question about chronic nerve pain and extensive numbness of inguinal neuralgia remaining years after a botched hernia surgery causing nerve damage. So that is truly like surgery damage and deep-rooted. I think you can get some relief with magnesium glycinate and also a B complex here. Needs to be tried. Because it's truly like it was mechanically, it was cut, you know, or scraped or damaged. Oh, here's somebody asking about TMJ, which is trigeminal nerve. Let me just Google something quickly. Oh no, it's the temporomandibular. It's the actual joint, the jaw joint. Yeah, B vitamins for sure. I've heard about a variety of injections, including prolotherapy, where they used sugar, dextrose, to inject in order to treat this. We actually had, I saw one of the people registered today was one of my favorite prolotherapy physicians, Lionel Labbé. I hope he's present. Actually, I'm not sure if I can see him, or he might wait for the recording. But yeah, he would have very specific injection therapy for the TMJ handy. I would be sure of that. Not my specific field, I have to admit. So I'm sorry about that. But I mean, I always think that with any kind of nerve pain, that magnesium B complex combinations will give you at least some relief. So I think we're at the end here. And that was a long Q&A. I was right in doing so. I hope this was of value to you. And I always enjoy these Q&A sessions tremendously, and almost, yeah. And I believe next time we have our new lead educator do a webinar on osteoporosis. Andrea Bartels is going to take the lead there. It'll be very good, I'm sure of that, and I believe we will provide Q&A together at the end. Okay. Thank you very much, and see you next time. Thanks.